Good afternoon, everybody, and welcome on this Friday afternoon. My name's Clint O'Brien. I'm an Associate Director at CEDA, and it's my absolute pleasure to convene us all here today for this discussion. For those of you who aren't yet members of CEDA, the Committee for Economic Development of Australia is an independent, non-partisan and member-driven organisation. We progress good good social and economic policy for the benefit of all Australians. We deliver leading thinking and thinkers from government, community and academia, and we publish our own independent research work and policy work. I'd like to acknowledge and welcome any First Nations people here in Australia who are joining us today and pay my respects to elders past and present. CEDA has been a very long supporter of Indigenous Australia and a supporter of recognition and reconciliation. And our support remains. We're committed to shining a light on and enabling truth-telling and healing for Indigenous Australia and to creating improved outcomes for those communities. Today, you'll hear from a great line of speakers, as some of them will be joining us from Europe, some here from Australia, as we provide actionable steps and recommendations for policymakers and healthcare sector leaders to drive sustainable initiatives across the sector. This is, of course, something that happens among a whole suite of work that CEDA is undertaking on decarbonising right here, right across the country, and indeed right across sectors. To join the conversation today with our speakers, please put your questions forward, and you can do that by accessing the Pigeonhole details that are on the bottom of your screen. If you're joining on the live stream, you'll slide down and find a button where you can do that, and you can also access Pigeonhole through a link that will have been provided. The password, if you'd like to enter that, is simply health system in all capital letters. For demonstrating their commitment to and support of today's topic, I would very much like to thank Philips, CEDA member Philips, for their very significant support in bringing today's event together with us. I'd also especially like to thank Olesya Struk, the Senior Director of Group Sustainability at Philips, who I'll soon hand over to and who has kindly agreed to be our chair for today and indeed the moderator for your discussion and questions. But I'd like to also thank all of those speakers who are making the time to join us. Kylie, the Chief Executive Officer of Australian Healthcare and Hospitals Association, Haukilahti, Vice President of Tays Heart Hospital in Finland. Aki will forgive me if I've mispronounced that. And Angie, Associate Professor of Monash Sustainable Development Institute. It is really great to have you all joining us. Thank you for doing so. To all of those you viewing, please enjoy and participate wholeheartedly. We look forward to catching you afterwards. Olesya, over to you.
Thank you very much, Clint. First, I would like to emphasize the critical importance of the topic of sustainable healthcare. Globally, healthcare systems have a significant carbon footprint, 4 to 5%, more than aviation or shipping, and this makes a major contribution to the climate crisis. At the same time, half of the global population, 4 billion people, lacks access to basic healthcare services without suffering financial hardship. So it tells us that something needs to change. And there's deep connection between environmental and human health. There's significant scientific evidence that higher temperatures cause over 100,000 deaths per year and are related to growing diseases like respiratory, for example. Now, in Australia, the recent Sustainable Healthcare Survey by Philips shows that 79% of Australians believe climate change impacts their health. 2 out of 3 Australians call for sustainable healthcare that meets their needs while supporting the planet. How do you define sustainable healthcare? Well, sustainable healthcare is the practice of reducing healthcare carbon footprint by sourcing energy from renewables, reducing materials usage by circulating products, use less, use longer, use again. This is a principle of circular economy, eliminating pollutions and resource waste, digitizing healthcare infrastructure with cloud-based solutions, making use of responsible artificial intelligence, and greening the data storage, and also buying sustainably to decarbonize the supply chain. And these are just a few examples. There is also a strong sense of urgency. 60% of Australians think sustainability in healthcare must be urgently addressed. 1 in 2 do not think that sustainable healthcare is being widely adopted. Interestingly, technology is crucial to closing this gap, with more than 85% of respondents indicating technology is at the heart of sustainable healthcare. Next, all of this prompts a question. What are the responsibilities of leaders and policymakers in Australia to address the urgent need and call for sustainable healthcare now? In our survey findings, 4 out of 5 Australians believe that there is more to be done to make healthcare in Australia more sustainable. They are calling for wider adoption of sustainability practices among healthcare providers and more education to the public. This emphasizes the relevance of the Australian First National Health and Climate Strategy, adopted last December. Its vision is healthy, climate-resilient communities and a sustainable, resilient, high-quality, net-zero health system. This strategy presents an opportunity for policymakers and healthcare leaders to align their efforts with national goals and protect the health and well-being of the population from the impacts of climate change. At the same time, there's political discussion in Australia if the country should or should not pursue legally binding climate targets to cut emissions by 43% from 2005 levels by 2030, which might impact the strategy and the sector's ongoing efforts to make healthcare more sustainable. Now, without further ado, I would like to turn over to the esteemed panel of speakers that have wealth of expertise in relation to policy, organizational leadership, and global best practices in sustainability. A few words about Philips. It is a pleasure for us to facilitate this discussion. We are a health tech company that is building on a decades of sustainability experience, including reducing energy consumption, waste, materials, and restricted substance usage. Philips has operated globally carbon neutral in our operations since 2020. We embedded eco-design principles and circular business model into our innovation processes and ways of working. We offer a range of health technologies and innovations that help reduce healthcare providers' impact on the environment. A little bit about the process. First, the panel speakers will give an introduction, and then after it, we will turn to questions from the audience. LinkedIn passcode details will appear on the live stream window, as Clint mentioned. We are unlikely to get through all audience questions, but please vote for your preferred question. Again, the goal of the webinar is to equip the audience with insights and actionable recommendations that will shape policy and leadership decisions as they work towards a sustainable, net zero health system for the collective benefit of the nations. Now, I would like to hand over to Aki Haukilahti, Vice President, Tays Heart Hospital in Finland, a pioneering cardiac care provider. Aki will give a short address about the Tays Heart Hospital sustainability vision, commitment, and plans. Aki, over to you.
Thank you, Olesya, and have a good afternoon, everyone, and greetings from Finland. We actually have a midsummer eve morning here. I'm representing Heart Hospital Tampere. So we are a hospital fully focused on heart patient care. And our main site is located in Tampere, Finland, in Tampere University Hospital campus. And we have totally 6 sites in Finland. So we're the leading heart patient care service provider in Finland. We have roughly 1,000 employees in our organization. Total revenues roughly 130 million euros per year, and we take care of roughly 15,000 cardiac and surgical procedures and close to 200,000 care events per year. And about sustainability, so we took sustainability as a core of our strategy in 22, and that was when we was looking the big changes in the surrounding, and actually understood that all the sustainability approaches that, or at least how we look at that, are in line on our goals in way forward. So we look sustainability from 3 perspectives. The first one is social. So that includes the good access to care for patients. And then secondly, or firstly, employee well-being. We know there's a lack of staff in the healthcare sector, so we want to take good care of our employees and focus on that. And secondly, the economical perspective. There's a lack of money in the healthcare system, so we try to pay attention on creating value for our customers. So we build value-based healthcare programs, value-based healthcare service models, and try to increase the value that we get for the euro spent here. And thirdly, there's the environmental aspect that was also quite new to us. We have worked with sustainable development for 10 years, but now in the last couple of years, we've actually put a lot of effort on the environmental aspect also. And a few words about the environmental aspects. So firstly, as I mentioned, we didn't know much. So we have a 15-year partnership with Philips. Actually, Philips is providing for all of our sites all the imaging machines, all the ultrasound picture archive systems, and so on. So it was natural when Philips had the knowledge in Europe on sustainability theme. So we did in cooperation quite a large sustainability analysis in our organization that cover the supply chain, the medical equipment, and then also the clinical operations. And why we did that analysis is to kind of understand where we are now and what's the way forward and where are the lowest hanging fruits, so to say. And I think it was really eye-opening in many ways, the sustainability analysis that we did. I give you one concrete example. We measured the one coronary procedure CO2 impact. So, and we understood that in supply chain and consumables, it was 20 kilo CO2 per procedure. Waste was 10 kilo per procedure, and our own operations and the energy consumed was 1 kilo. And that's actually in a line on a hospital level also. So the biggest issue is the consumables and services used to deliver the care for the patients. And secondly, hospitals generate a lot of waste, actually 4 kilo per patient on average in our site. And then thirdly, there's some impact also on the energy, what's consumed. So and what have we done and how are we going forward? So I think firstly, we paid attention on our own operations, which is small, and the purchased energy. And we cut 89% of our own operations and both energy CO2 footprint. So that was quite easy, paying attention on what energy we use, and we cut the fossil fuel sources in our operations. But that's small. It's good to understand that it's small in a hospital level. But then waste, that's the second part. So we're putting attention on cycling and sorting, and also eliminating waste on consumables and patient meals and so on. So that's also in line on our business goals to kind of improve margins and eliminate waste. And have to say that everybody is involved in our organization is this. And a comment from our employee was that finally the organization is also doing something for this in the hospital, because everybody is sorting and cycling at their homes. So why isn't that done in the hospitals? And there's a lot of plastic products used. And thirdly, I think the biggest issue is the consumables, and that's something we can't solve by ourselves. So we need cooperation with the industry, especially with the medical device industry. So we pay attention on air freight and packaging materials and these kind of topics. And now we're this year, for example, doing pilots with some of our main providers to try to find solutions how to impact on those. So I think that's a kind of an introduction, and maybe one note that we also from a business perspective was that there is the digital care services. We understood that also the hospitals has quite a great impact on the community, in a way that the patients and the relatives are traveling a lot to hospitals, and we understood that actually by increasing the use of digital care services, we can also have an impact. Because, for example, all of our pacemaker patients nowadays go on remote monitoring, and we have over 8,000 patients in remote follow-ups in pacemaker therapy. So, and we cut in half the visits in hospital for this patient group. And also, we also cut in half the carbon footprint in these operations. So I think that's also an example on how we can actually more efficiently provide the services, and then considering the environmental also in our operations. I think that's where we are now, and we have a green plan to go forward. Thank you.
Thank you very much, Aki, for this comprehensive overview, and also relating to the digital services role in digital technologies, like was emphasized in the Australian survey, that majority of people believe that digital technology has a role to play. And you brought an example how it can cut the emissions in half in the care pathway. Thank you for this. And now it is my pleasure to welcome Kylie Woolcock, Chief Executive Officer of Australian Healthcare and Hospital Association, for an opening address. Kylie, please, over to you.
Thanks, Olesya. So AHHA is the national peak membership body for public and not-for-profit hospitals and healthcare services in Australia. Our membership spans the entire health system. So we have hospitals, primary health networks, primary and community health service providers. And we also have our research arm, which is the Deeble Institute for Health Policy Research, with a membership from academics in health system research. So with this diverse membership base, our reason for being is really around that enabling collective leadership and action. We connect grassroots innovation with research and with the national policy levers that can enable the reform that we need. We know that so much around us encourages silos and divisions, separation, and contributes to making leadership a very lonely business, including in the sustainability space, but also that disconnected leadership really prevents the spread of innovation and best practice and solutions. So we've been involved in sustainability for some time now, within the Australian context, being the founding member of Global Green and Healthy Hospitals Network for our region, which I'm sure many people have heard of and are involved with, the Climate and Health Alliance, the HEAL Research Consortium, and most recently the Chief Medical Officers Advisory Group for Australia's first National Health and Climate Strategy that you spoke of. But we know that sustainability, the challenges that we're facing in health, they don't respect country boundaries. So it's lovely having Aki here. We know that we need this international response. So we've most recently partnered with the International Hospital Federation, which is, I suppose, the equivalent of us, but at an international level, to look at how we can accelerate sustainability in the health sector. And that's really about connecting a data-driven approach to hospital strategy and actionable insights. This all really has come out of what we've been observing in health systems to date. There's a lot of activity that's happening, and we really do need to connect it. We've been observing, many efforts across waste and energy, transport and in procurement. And what we learned from the NHS experience was that with 60% of emissions coming from clinical care, we also really need to focus on how we design care pathways. We need to see environmental sustainability embedded in that design of care. So it was really lovely hearing what Aki was saying about in Finland around value-based healthcare being part of their strategy, because it really does provide that framework where we're aligning interests into what's best for patients, what's best for our planet. There's lots we can do in this space, and we, including how we do prevention better. And you've talked about care in the community and digital transformation. I thought I'd focus with the short time that we have on the importance of reducing rates of low value care. What we know here is that estimates suggest only about 60% of the healthcare that we deliver is in line with guidelines, and that leaves 30% being waste or duplication or low value care. And that final 10% is actually care that leads to harm. So doing less is a really obvious way to reduce emissions. Most waste is from medical services and technology overuse, but we know that there's a lot of variation in this. For Australia, we've seen that the proportion of healthcare encounters where appropriate care was received by Australian adults ranged from 13%, which was related to alcohol dependence services, to 90% for coronary artery disease. But there was an average of about 57% across 22 conditions. I'm not sure about in Finland there, Aki, but in Australia, there's been significant investment in identifying low or no value care. We have the Australian Atlas of Healthcare Variation that maps care and prompts investigation when we see variation. We have Choosing Wisely. We have an Involve program by the physicians, the MBS review, the prosthesis list reforms. We have research consortium Wiser Healthcare, which looks at overdiagnosis and overtreatment. We see numerous clinical quality registries and data analyses undertaken at the individual, at an organisation, at state, at agency levels that also help to identify low value care. But just identifying it hasn't been sufficient for reducing it. Reducing it requires this incredible coordination of interventions. And again, we see lots of activity in this space in Australia. Health technology assessment plays a big part. Our funding models will incentivise and how they incentivise low or high value care. The regulation that we have that enables our workforce to work to the top of their scope of practice influences it. Our access to data, making sure that we're measuring the right data. Consistency between the public and private sectors is a big one too. I mean, the list just goes on and on. I think also, Olesya, you mentioned responsible AI. I think we're going to see increasing, it has the potential to improve high value care, but it also has the potential to exacerbate more low value care. So accelerating sustainability from our perspective is a challenge we need to face together across research, policy and practice. And so I'm really pleased to be part of the conversation today.
Wonderful, Kylie, and thank you so much for this rich vision and strong pillars for sustainable healthcare that you called out. And it's wonderful that you mentioned the point on leadership. Would love to talk a little bit more about that, and also that sustainable healthcare is at the core of the operational, financial, and also the clinical care pathway. So thank you so much for this short summary. And now it's my great pleasure to give the floor to Angie, Associate Professor at Monash Sustainable Development Institute, for an opening address. Angie, please, the floor is yours.
Hello, everybody. Thank you for inviting me to join you today. I'd like to just make a quick acknowledgement of country as well. I'm calling in from lands of the Wurundjeri people and pay my respects to elders, past and present, and any Aboriginal colleagues who are with us today. I think one of the truisms in any system, but particularly in the health system, is that every system is perfectly designed to get the outcomes it gets. And that apparently was said by Paul Batalden of the Institute for Health Improvement. And I think, when we look at our Australian health system, we are consistently in the top 5 of high-income countries' health systems. And yet, like other high-income country health systems, we have enormous challenges. We have rising demand, we have rising costs per capita and absolute costs, we have workforce shortages, we have access issues, particularly in rural and regional areas, and we do have some unwarranted variation of care, as Kylie was talking about. So as a health system, we have challenges. And we have to remember that a lot of the demand is driven by the health of our communities. And we know that our health system is not necessarily serving our communities as well as it could. We have extremely high levels of overweight and obesity. And we have perhaps even up to 8 in 10 people have a chronic disease. And much of that is driven by what's happening outside of the health system that the health system doesn't have any ability to control. Housing, the way we feed people, the way we make energy, the way we transport people. So just wanted to set it a bit in this broader context as well. And this is all without even considering what climate change is going to do in terms of community health and in terms of the demand for our health services. And of course, much of that is also driven by other sectors, by the emissions that we're putting out into the atmosphere. And as the health service responds to this, unfortunately, we're also creating emissions, as Kylie and Aki and Olesya have already talked about. And so this is quite a painful position for a sector that is predicated on doing good and not doing harm. And we know certainly, it's great to hear of the Australian survey and that the public think that we should be doing more, but it's also very clear from multiple staff surveys that our staff also expect us to be doing more. And Aki was referring to that as well. So fortunately, again, as Aki was talking about, sustainability aligns with the imperatives that we have in the health system. It's not something that we should be seeing in opposition. It's an additional lens that we should be using in terms of addressing the challenges that we have for our health system. And we've already talked a little around the kind of the kit that we use and the facilities and buildings and energy, the supplies and consumables, the procurement and how we dispose of them, the circular economy issues, and then crucially, as Kylie was talking about, the way we actually deliver care, and that we can reduce a lot of the emissions by streamlining and making greener the way that we deliver care. And essentially, sustainability for me is fundamentally about waste reduction. And when I talk about waste, I don't just mean material waste. I mean waste in all of its forms: time, energy, research waste, etc. And we do have, tens of thousands of flowers blooming across the system of fragmented but excellent approaches for trying to improve this. And that's what's so great about having the National Climate and Health Strategy now, that we have a kind of overarching umbrella that we can all come up and work under. And get those, better outcomes for patients and for populations, better outcomes for staff. This is often seen as a recruitment and retention issue for staff. They want to work in organisations that actually align with their own values. And of course, we know that, increasingly we're going to have to start disclosing our climate risk and our actions to address those. Policy I guess what I'm trying to say is that I've worked in this space for about 15 years in the UK and in France and in Australia. And I've really seen in the last couple of years a massive increase in momentum. And we know from sustainability science that, it usually takes an S-shaped curve. And I think we're just at that point of takeoff at the moment. Which is fantastic. And it's not surprising that it's taken us a while to get going on this. I think the challenge we have is that we've got to go really fast now, given the imperatives of carbon emission reduction and the deadlines and the impacts that we're going to see on the health of organisations. One thing that we're doing at the moment in MSDI is pulling together a consortium of health sector organisations. Some are government, some are private, some are public hospitals, some are professional associations, to work together to work out how do we accelerate this transition? How do we go beyond what we already know into new territory for the transformation that we need to see? So the last thing I just wanted to say, though, is what we're doing enough? And my fear is that it's not enough. We're spending quite a lot of time trying to optimize and stabilize our existing system and do what we're doing already a little bit better. My fear or concern is that as climate change progresses, we are going to need to go through a massive transformation. And we can either do that in a planned way, or we wait until the situation is so bad that we have no choice. And I know which one I would prefer. And certainly if I was a vulnerable person, or a vulnerable country, I'd much prefer a planned transition. So I think there's three things that we need to think more about. How do we value things? Is money the only thing that we care about? Or do we care about people, and do we care about planet? And also, how do we address this issue of time preference? The fact that we discount costs and benefits in the future, that doesn't help us take a long view for planning. The other thing I'd like to think about is, are we organising and governing ourselves in the most effective way for the complexity that we're dealing with? We've already talked about the silos. Silos have their benefits, but you really need strong integration between them. And I think we spend too much time thinking about the boxes and not enough time thinking about the glue. So I think it would be worth reflecting on, are we organising ourselves in the best way for the current challenge, both from a research perspective, but also from a policy perspective. And the last question I'd ask is, are we preparing the next generation properly for the way that they and us are going to need to respond? Are we focused too much on our silos and not enough on integration? So with that, I'll leave it there, and I look forward to the conversation.
Thank you very much, Angie. And it's great that you brought the broader context, that it's a broader societal challenge, but also you alluded to the new definition of value And also the immediate questions perhaps we can start acting upon is how do we organize and how do we build a collaboration. Great. Now it's time for us to turn over to questions, and I would like again to invite the audience to post the questions and to vote for them. But let me maybe start with the overarching question as to each of you about the role of partnerships. What is the role of partnership of public and private sectors, industry and academia? And Angie, you mentioned that there's consortium that's being built, and I think Kylie also mentioned that the policy is the umbrella under which we can operate. So what is the partnership towards role of partnership towards sustainable healthcare? And what are actionable steps and recommendations as the goal of this webcast that we can share to make such partnership a success? But first, maybe I'll reach out to Aki for his experience in Finland about it, and then please let's have a short discussion.
Yeah, thanks. And yeah, we see partnerships really important, and those and creating and keeping and increasing our partnerships in those crucial areas that we have in our strategy. So it's included. And for example, the partnership with Philips, okay, we started with image guided therapy and ultrasound and patient monitoring, kind of building the partnership to get a good user interfaces and same user interfaces for the staff in all of our sites. But it also includes the development partnership. So it made it possible to focus on, for example, in sustainability also, and exploit the expertise that we have in both of our organizations. But otherwise, also I see when talking about environmental sustainability, I see it in scope 3, so and supply chain. I think it's crucial. I think no hospital can solve the scope 3 emission issues by itself. You will need a wider cooperation and maybe legislation also on top of that.
Good, thank you. And Kylie, would you like to weigh in?
Yeah, look, partnerships are absolutely critical in this space, and I would suggest that they're probably getting increasingly complex to manage. You know, it's one thing to have a shared vision or a shared outcome, but, you know, across both the sustainability space, but also the technology space, there's probably quite an imbalance in information and expertise that needs to be managed to ensure that there's transparency in decision making, ensuring that we've got the right data that's influencing to make sure we are actually progressing towards those shared goals together. In a way that's really, you know, very dependent on trust between partners. So, you know, absolutely need them. And I probably think we probably need a lot more support around how we do that effectively.
Great, Angie. Yes.
Yeah, I mean, I don't think it'll be any surprise that I'll say that partnerships are important, given my opening comments. I think what we're finding, you know, with the consortium, for example, is the value of having a range of different organisations coming from different perspectives, because it's so easy to get our kind of blinkers on about our own imperatives and our own organisations and what we need to do, and forget that sometimes the actions in our own organisation impact on other organisations. So I think that kind of constant iteration of people telling stories about their impact, and, you know, telling stories about how somebody else's decision sometimes has an impact on their organisation has been quite valuable. I think in terms of actionable actions, I think the idea of actually having dedicated people whose role is to integrate between organisations. We tend to think that that somehow just happens on the side of our desk. We've got our main job, and then, oh, by the way, I'll make sure that I work with stakeholders. But I think actually developing dedicated expertise on how you bring different disciplines together, both in a research organisation, but also in a policy or practice perspective, would be something that we should be considering collectively as a dedicated expertise.
Great. So dedicated integrators, the role of leadership also in this, I think it's a great point. Thank you. Then I will turn over to a question from the audience. So the top-rated question is the following. Australia launched its first national health and climate strategy last year, yet no funding was allocated in the federal budget to advance it. And what message does it send to the healthcare sector? It's about financing and sustainability. Perhaps, Kylie, do you want to start, and please the rest chip in?
Yeah, I don't think there would be anyone who would dispute that there needed to be dedicated funding for the strategy. But I will say that there's not no funding for it. We have seen the Commission for Safety and Quality in Healthcare. It's got a lead role in the low value care space. And we know that there are other, because sustainability isn't something that's isolated, is embedded across so many areas, that there is still capacity and potential for lots of work to happen. So not to be too disillusioned, I suppose, without the dedicated funding, but of course we always think that there does need to be more for this. And it does, and the message that it sends.
Yeah, can I weigh in there as well? I agree with you, Kylie. I think, it is a shame and we always would want more money, but the fact that we've got a 17-person strong sustainable development unit in the Commonwealth, and the way that they're working with other sectors, and that each state and territory is developing teams, that we're seeing chief sustainability officers in organisations in Australia, that I think I think there's not enough funding, but there certainly is more funding than perhaps you would perceive from looking at the budget papers, for example, that, organisations, departments are rearranging their funding allocation to make sure that at least some of this work is done. And when I compare with the NHS England, for example, has about 60 people for a population of around 50 million. So that if you add up the number of people that we have working in government departments on sustainable health, it's perhaps not as bad as we might first think.
And I think maybe I'll reach out to you, Aki, because you were the Chief Financial Officer when the Sustainability Initiative, I think, started, right? Perhaps you can share your experience from the finance angle.
Yeah, thanks. And maybe to continue also from the financing perspective. So we, of course, if we look at the hospital level, a single hospital level like us, a heart hospital. So we see, we invested some money by ourselves for environmental sustainability analysis. We also did some, we cooperated with Philips, but then we also did some small analyze with the smaller Finnish CO2 company, and we calculated and quite fast understood that yes, this will pay back in quite a short time. But then when it comes to Kylie mentioned the outcomes, and for example, which are crucial when looking from the economical perspective, the low value care, the outcome measurement. So at least here in Finland, we don't have standards for outcome measurement. Still not today. We have really good registries, clinical registries, but when you have to look, you have to look the outcomes from all of the perspectives. So and especially include the patient-reported outcomes on those, and we are doing that now. And our aim is to have the outcome measured for all of the patients by 25, and also in environmental sustainability, as I mentioned, the scope 3 as the supply chain. So that's a hard part for hospitals to do and invest by themselves. So I think that's something where you would need a coordination in a national level or even a wider level.
Thank you very much. Then the next question here's for Angie. You mentioned a planned transition. Question from Kirsty Sima. Thanks for that. You mentioned a planned transition in a broad brush. How you think we need to rethink the delivery of healthcare before climate change takes the opportunity off the table altogether?
Oh, that's the $64 billion question. I think there are many, many ways, and I think we're still working that through. For me, I think it is a lot about the things that I was mentioning around values, organizational, preparing the next generation. But to be a bit more, I guess, a bit more specific, I'm a public health physician by background, so I would dearly love to see much more emphasis on prevention in its broadest terms. So actually, collectively, instead of departments looking at outcomes in isolation, looking collectively at what are the best outcomes for our population. And that might actually mean some health funding goes to housing, or goes to transport, or goes to food regulation, supply, for example. I think we should be reframing the way we think about how departments are funded and what outcomes we're looking for. That kind of also feeds into this idea of the goals of the system. And I think we could make much greater use of legislation and regulation so to get to a point where this is embedded as a core value of what we do in health, that our role is not just about health of people, but also health of planet. And I guess the other thing that I feel that we could be doing much more about is citizen empowerment, patient empowerment, looking at non-pharmaceutical, non-medical means of treating, supporting people with their illnesses. So those would just be 3 things off the top of my head that I'm thinking through myself and with the consortium about what are the kind of more radical transformational changes we need to make. I could also start talking about funding models and activity-based funding as a driver of a lot of the problems that we see, and how can we shift to outcomes-based commissioning and payment models. But the other panelists may well have some thoughts about this too.
Indeed, thank you. Kylie, do you want to come in?
Yeah, look, it's a really challenging area, as Angie mentioned. It would be nice to start with a clean slate from scratch, but that's not the reality of it. And the problem is the time lag between when we'll see the change in outcomes when we invest in prevention. So I think there's an important strategy not to necessarily try and shift funding away from our hospitals, because we all want good acute care when it happens, but actually to say, well, actually this is important to us as a society and we want investment in preventive care. I really liked what Angie was saying about that, the whole idea of supported self-management, again, not seeing people self-managing their conditions as a sort of a tick box, as that's their individual, we put the responsibility on individuals, but actually how do we support them to self-manage their conditions, because that in itself will be, lessen the impact on need for health care. And we're seeing sort of some policy initiatives in that space, and certainly drawing on the UK's social prescribing model. I guess that, I personally hate the language of social prescribing. I think we're medicalising something that should be around social well-being. But I do think, given where our health system is, we do need to give strategies to start shifting it, but we really should see that as a an interim solution until we get to the drives data to invest in better preventive and better social supports for people. I'd be interested to hear what Angie says in that space too, but it's, I think it's complex and we need to all be working together, but we also have to, as, leaders need to be willing to release, their control over certain areas. They need to be looking across boundaries that typically have been, restrained what their efforts are. And that's really hard too. So I think that's where connecting leadership is a really important a part of this puzzle.
Thank you. And there is also a follow-up question. So how do we balance increasing investment in prevention activities versus reducing resource or reducing costs? Maybe Aki, do you want to share a perspective on that? Yeah.
Well, I think also to continue also what Angie and Kylie was mentioning. I think it's really important to measure the outcomes and to manage the data, to be able to create value-based healthcare models and service models. An example from Finland and from our center. We started 10 years ago to pay attention on value-based healthcare, and we quite fast noticed that the key point there is to manage the data. If you don't have a data, you can't build value-based care models, and that's why. So it can be an obstacle. So fee for service, it's quite simple. That's the mostly used in payment model in Finland. But in our organization, nowadays 79% of our payments are based on value-based care models. It's a cohort-based and then also directly service-based. For example, in pacemakers, we get the payment as a hospital on monthly payments, tied on the value created for the patient. Also, we have some digital care models where the payments are monthly payments, tied on the value created for the patient. Then we have a cohort level models where it's capitated, kind of a modern capitation, where there's a risk sharing and then shared savings and bonus sanction systems. And all this has required data. So I think so far as the hospitals and the healthcare providers can't manage data, it's really hard to go forward with the value-based payment approach.
Great, thank you very much for answers to this question. There is a next question also to you, Aki. What, if any, environmental disclosures are required in the procurement rules in Finland health services for the purchased goods and services and capital goods as well?
Sorry, could you say again the beginning?
What are the disclosures that are required in procurement rules in Finnish health services for the purchase of goods and services? If the environmental disclosures are required, if at all, in Finland?
Yeah, we have some, but it comes from the European Union legislation that we follow in the procurement guidelines. So there is several requirements, but I still for the providers and for the products from the sustainability perspective. But what I would be looking for is that it's still not enough. For example, we are a large buyer of consumables, and today we don't have a good understanding on what's the. Of course, we know what the origin is, but we kind of don't manage well the whole supply chain on where does the product come from, how is it come, and what are the product sizes and materials used and all that. So there is the European Union legislation in procurement that we follow, and we have some environmental regulation in our tenders, but I think it's not enough still in Finland and in Europe to manage systematically the supply chain.
Clear. Thank you very much. And I think we have the last 1 or 2 minutes. I would like to use it for the question about the leadership towards sustainable healthcare. I think, Kylie, you also started about that in your address, in your opening address. So what would be the advice that you could share with the community, with the audience, about the leadership and key success factors on this, on the way towards sustainable healthcare? Kylie, go ahead. Yeah.
I think, there are a number of elements to it. I say leadership is needed at all levels, but we do need to also connect it. There's for health services, I think there's a need to recognise, and I know this has been mentioned already, that the value that our workforce places on this. So how do we make sure that they have room to identify initiatives within their own scope of work, but that connects to actually doing something that, does actually can be demonstrated to benefit the health service. But also, how do we connect our, the executive leadership team with the potential benefits from what is happening on the ground, and ensuring that they demonstrate commitment to sustainability, so that there isn't that disillusionment that sort of people sort of hear the buzzwords but don't actually see it translating to what's happening in practice. And communication is obviously a really important part of that. I think our leadership, probably needs to be pragmatic as well. There is a level of that to this, but we can continue to revert back to we need more research, but the reality is there's a lot of research already, and we just need to get on with, and I guess low value care is one of those elements. We don't need to go and do life cycle assessments of every single pathology or laboratory test that's out there. We know that if we just do if we stop doing things that don't need to be done, that's a good thing. And I would say, really embracing data-driven approaches would be the other one, making sure that we are actually using data to drive our strategies and our actions.
Great. Angie, would you like to add to this?
No. I'm done. Olesya, did you want to thank our speakers, or I'm equally happy to do that for us?
Yeah, sorry, no problem. So just wrapping up on the question about leadership. So perhaps we'll give a few more words to Angie and Aki to add to this, and then we will do the closing summary. Yeah, Angie.
Yeah, fantastic. Thanks. I think Kylie did a really good job in answering that question. For me, this is mostly a leadership competency, and that creating the enabling environment for our workforce to be able to do what they do well is hugely important. I guess the only other things I might think about adding are giving people space to fail. I mean, obviously, we don't want people to harm patients and fail in that way, but to try new things and to innovate. I think sometimes we can get very, very risk averse. So there's something about courage and about allowing people to try new things is important. And I think sharing those stories, the more we share what works and what doesn't work, the more demonstration projects we run. Rather than doing more and more randomized controlled trials or whatever, or life cycle analysis, is actually, let's see how this works in an environment, whatever initiative it is, and then share what worked and what didn't and why, so others can learn from it.
Yeah, powerful. Thank you very much. And Aki, would you like to share your perspective and advice?
Yeah, we've tried to, and we are approaching this very important topic, sustainability topic, in a positive way in our organization. We try to keep everything that we communicate and related to this positive. So we try not to make it mandatory, but instead of create the opportunities for personnel to succeed in these topics. And then themes like go green, keep it on a screen, in printing and this kind of things. So I think it's really, it has been good and resonates well. This topic resonates well among highly expertise healthcare employees and personnel. So the healthcare personnel is highly trained, and they I think they adopt this well, and so it's good. But on a policy level, I think you would need. We have in Europe also, we have the situation that we have followed in reporting, for example, in environmental sustainability. By ourselves, we have started to follow the GRI reporting standards, but now there is the European Sustainability Reporting Standards coming up, and it's it's been kind of a messy. So I think we need a good frame on where to work. I think it's more clear for hospitals also when you have a good frame, and it's also in outcome side. We have the ICHOM standards, we have the COMET taxonomy in outcomes. So I think you need some frame in a national or system level to be able to then scale it up.
Great, thank you very much. And we are coming to the close of this rich discussion. So I really appreciate this diverse perspectives and the great insights that hopefully give the actionable direction and examples to the audience how to act on sustainable healthcare. Specifically, for example, just a few points. So we heard from experience in Europe that how important it is to look at the data-driven approach, that also there is the very good combination of economical upsides and sustainability choices. That is also part of both operational processes, technology part, but also the clinical practices and the role of the government regulation and the transparency for this. Then we heard also from Kylie from Association of Healthcare and the Hospitals in Australia about the broad and the strong vision and the direction of the strategy for sustainable healthcare and the key pillars of this, and the role of partnership and collaboration, this important factor. And also Angie shared the perspective from the academia and the collaboration in the consortium, how important it is to think about the preventative healthcare amongst other things, and also think about the holistic societal view on how we define value, how we collaborate, how we run the experiments, and how we redefine also the style of leadership on this journey. So with this, I would like to mention that in Philips we relate to these points very, very much, because also in our company we embedded sustainability across our businesses. It's not a separate sustainability strategy, but it's a strategy which has sustainable healthcare vision and commitments towards this. And Philips is excited about the collaboration with and support for healthcare leaders in Australia and their collective efforts to developing a more sustainable healthcare sector. For example, a sustainability program with Tampere Heart Hospital that Aki mentioned, it follows a similar analysis conducted by Philips earlier in 2023 at Vanderbilt University Medical Center in Nashville, United States, and also the private biomedical research and clinical care provider Champalimo Foundation in Lisbon, Portugal, that aimed at reducing the carbon footprint of the diagnostic imaging. So it's in closing, so it's important to translate the insights and recommendation into actionable steps. In a new public sustainable healthcare survey in Australia, while 79% of Australians recognize the importance of sustainability in healthcare, nearly 29% are unaware of how to support the healthcare providers' sustainability practices. So we hope that this live stream gives you some ideas and tools and the confidence in this practice. I would like to express the gratitude to esteemed panelists for their valuable contributions and insights. At Philips, we believe that it is the collaboration and partnership across the value chain that will make it a success. So I would encourage continued collaboration of the participants of this webcast. And also, finally, thank you to the audience for your participation and engagement. It is collective responsibility of policymakers and healthcare leaders to prioritize sustainability in this sector. And thank you very much for CEDA to arranging this webcast. Thank you very much for Clinton team to making this happen. And now I invite Clint, who has been participating with us in this discussion, and I would like to invite him to close the live stream.
Olesya, thank you very, very much. You're very kind. I wouldn't go as far as saying participating, but watching very interestingly, most certainly. I have to say, Angie, a couple of things come out of your mouth that I fell a little bit in love with in the course of this one today. Not just health of people, I had to write this, not just health of people, health of planet, radical transformational change, and empowering health consumers. So I dare say you may have made yourself a few new fans among CEDA's mob today. I also wanted to thank Aki and Kylie for their really thoughtful comments. I learned something from each of you today, and I always think that is an absolute good use of time. Mindful for our audience, it's Friday afternoon, so we will let you go swiftly. But before that, I did want to thank Philips for their very serious support in this. We are such a great fan of your work. And Olesya, it's not every day that we get to have a Ukrainian in the Netherlands moderate a CEDA forum for us. So I'm very, very thankful for your time and preparation as well. I'll let everybody go this afternoon. Before I do, a few quick notes from us on a few things coming up at CEDA. One of those will be our next live stream, which will be our annual State of the Nation conference streamed directly from Canberra next Thursday on the 27th of June, with a fair swath of Parliament in there, and indeed some very relevant content if you'd like to tune in on that. Do also know that this work will continue for CEDA in the next 6 months. A couple of key themes that came out today: the use of data to inform good work, decarbonising key sectors of the economy, and building the workforce right across the care economy are topics that you'll certainly be seeing more from us in the next 6 months. Of course, if you'd like to participate or collaborate on those, please do reach out to us, and I'd make the same invitation for those on the screen here and to those particularly at Philips. If we can connect you with the good people here or Philips so you can learn more about their work, we'd be very happy to do so. Otherwise, that's it from us for today. Thank you for taking the time to tune in and in doing so supporting the work of the Committee for Economic Development of Australia. We're thankful for your time. Have an excellent weekend and we'll see you soon.